We are very keen on stakeholder engagement. We are very keen on making sure that we build consensus within the health sector, because that consensus is going to help us do two things. One is that we want to build public trust and confidence in the healthcare system, and we cannot do it when we are not with you. We have to do it together. So there is no more hiding. We will all come here and discuss the issues of healthcare, however difficult those discussions are. And on that, we have been instructed by the Cabinet Secretary to create platforms. And I have suggested that we create platforms for engagement. Waziri is a very bold person. He is always telling us, go meet those people. So I have met with the renal nurses, I've met with the Kenya Diabetic Group. We are meeting with you. Waziri has given us direction that he will lead from the front. We will come here and hear all the uncomfortable things that we can hear, and we will work on them. And that is the change. That is the change, because we want to build the consensus. And so, Waziri, with your direction, we are establishing these health policy platforms where we will listen to associations, we will listen to unions, we will listen to the civil society, we will listen to everyone, because we are also on a journey to establish order in the public sector. Bad manners must stop, where everyone is a law unto themselves. And that bad manners also must stop, even for you. Okay? Even for you. And I think you guys know us very well. You know me very well. So when I decide to push on an issue, you know there is no stop until it's done. So we must bring order in the public sector. We must bring order in the health sector. And you have clearly seen the direction that Waziri has taken. There must be one voice, one unified vision for the health sector. Not multiple actions, multiple voices, multiple things that sometimes harm our patients. So we are keen on this health policy platform. Number two, and lastly, is advice to my colleagues. I have mentioned this before, and I'll mention it again. In here, we have a lot of scientists. I see my professors are here. Professor Winongor is there. I saw him somewhere. I see my other professor is there. In here, we have a lot of experience. People who have managed schools as deans, people who have managed hospitals as med-subs, people who have even been in positions of CCs, everywhere. We have a lot of knowledge in here. Do not diminish your knowledge. You must rise to the level of thought leadership for the sector. You must put forward proposals that are implementable. You must put forward solutions of how this country must be run. Do not diminish all the knowledge and the resource that is in this room into something small. And you know what I call small? When you delegate the duty and the knowledge that you have of determining the policies that we have into begging for your welfare. That I call small. I think we must rise above that. And I want us to all coalesce our heads and look at what is the next big thing. The Social Health Authority that has been put forward to us has a lot of opportunities, the digitization. We have doctors right now unemployed, and I was talking to my professors last week, and I was asking them, you can't call yourself very successful as a professor with a clinic when your younger colleagues are not employed. What's your solution? What's your knowledge? What are you putting forward as a policy? Because the only solution can't be that the government has failed. That surely can't be the only solution. We must look at the context of the healthcare system. We must understand what we need to do. And then with the leadership of the Cabinet Secretary, we will help you do three things. One, we will help you align those your thoughts with the government policies. We will help you align it with the resource envelope. And number three, we will help you make it sustainable. But you must bring the thought leadership. You must bring the reports. You must bring the idea. That idea must be innovative. Don't be like Kodak that said, we did nothing wrong, but you collapsed. So you can sit all in this room and discuss after ourselves and say that we did nothing wrong, it is the minister. But your doctors are not employed. You can keep pointing fingers as much as you want to point fingers, but your patients are not getting the care. But your profession is losing the trust. I leave it up to you, colleagues. Rise above the little. Rise above the little. It's our time to change healthcare now.